Hi, I'm Lauren Perez, Associate Member in Cancer Epidemiology at Moffitt, and we're at ASH 2024. So I'm going to talk to you today about my poster on racial and ethnic differences and outcomes of multiple myeloma patients treated with idecabtagene vicleucel, also known as idecabtagene, or ciltacabtagene autoleucel, also known as ciltacabtagene. And these two therapies here are CAR T-cell therapies that have been approved for multiple myeloma patients that have relapsed or refractory disease. And what we don't know is how the outcomes look in racial and ethnic minority patients. And so we conducted this study in the U.S. Multiple Myeloma Immunotherapy Consortium in 19 institutions across the U.S. to really look at racial and ethnic differences in patient characteristics, safety, efficacy, outcomes, and survival in patients who are treated in standard of care practice. And so if we look here at the patient characteristics, what we found is that racial and ethnic minority patients are younger. They're also more likely to have a bone marrow plasma cell percentage of 50%, and white patients are more likely to have high-risk cytogenetics as well. When we looked at safety, we really didn't see any differences in CRS, ICANS, delayed neurotoxicity, infections, or second primary malignancies, but we did see differences in post-infusion cytopenias. What we found is that non-Hispanic Black patients were more likely to have severe cytopenias at day 30 and day 90, and this was driven by higher rates of neutropenia. We also found that for ciltacabtagene, non-Hispanic Black patients were more likely to have severe cytopenias at day 90, and as well as Hispanic patients. And this was driven by a higher rate of anemia in Hispanic patients and a higher rate of neutropenia in non-Hispanic Black patients. If we look here at the response rates, what we find is that idecabtagene is on the left-hand side. You can see that Hispanic patients have inferior responses compared to non-Hispanic Black and non-Hispanic White patients. But we saw no differences in ciltacabtagene responses. But when we look at survival, these differences do not translate into differences by race and ethnicity for both progression-free survival and overall survival. We also ran multivariable models for best response, progression-free survival, and overall survival, adjusting for a variety of different patient characteristics. And we still see that there are no differences for survival by race and ethnicity. We do see inferior responses for Hispanic patients, though, for idecabtagene. So in conclusion, what we found is that although there are some differences in safety by race and ethnicity and responses, we still see that survival is the same across all patients. So this leads us to conclude that these CAR T-cell therapies should be given to all patients.